incredibly significant now. Of course, I would say that as an academic working in the field, but I think other people are starting to recognise the importance now. And the evidence of that is actually at the European Stroke Organisation conference. So the session that's just completed was in one of the big rooms. It was a sell-out session. It was standing room only. And if I think back to even a few years ago, it used to be that the cognitive session was at the end of the day. It was competing with the cheese and wine. It was in a tiny room. So, the field has really moved on. People are realising this is significant, and we can put that significance in numbers. We did a meta-analysis 2 years ago, and we looked at the prevalence of dementia in everyone with stroke. So any form of dementia in anyone living with stroke, and it was 1 in 5. 1 in 5 people living with stroke is also living with dementia. So this isn't niche in any way. This is absolutely something that all clinicians need to be thinking about. People are convinced that this is important. And I do believe that people are beginning to realise the importance of this. The follow-up question then is, how should we be looking for it? There's been lots of debate in the field on the best cognitive screening test. When I was editor of Cochrane Dementia, we did a lot of work comparing one screening test to the other. The truth is, most screening tests are reasonably good. And I don't think we'll ever say there is one perfect test, because the test you use depends very much on the amount of training you have, the amount of time you have, the feasibility you have to perform testing. If you're doing testing in the emergency department of a busy hospital, the tests available to you will be very different to if you have an hour-long consultation in a tertiary referral clinic. So my advice to clinicians is, don't worry too much about the tool that you're using for testing, but just try and do some form of cognitive testing.